In this video, I'm going to tell you what heart failure is, its signs and symptoms, the causes of heart failure, how we diagnose it, and the treatment options currently available. If it's your first time here on my channel, my name is Hafiz and I'm a cardiologist training in London. I created this channel to increase awareness of heart disease and to tell you how you can improve your heart health. If that interests you, then click the subscribe button and the bell icon so you're up to date with all my videos. Let's now get straight into the topic. Heart failure is a condition where your heart can't pump blood around your body as well as it should. It doesn't mean that your heart has stopped working, but you may need some support to help your heart work better. Heart failure is a clinical syndrome, meaning it has its own symptoms and signs. Symptoms are things you feel, and when your heart isn't pumping blood as well as it should, it means you're not getting enough oxygen. This affects how your body works, including your breathing and your muscles. This causes some of the main symptoms of heart failure, like feeling faint or lightheaded, feeling tired, particularly with movement, having a cough that doesn't go away, or feeling breathless. And if you think about it, this makes sense physiologically, because in heart failure, the heart becomes weak, so is unable to pump out enough blood and oxygen. This results in blood or fluid building up or congesting in the lungs. This is why heart failure is also sometimes referred to as congestive heart failure. This also affects the rest of your body because the heart pumps blood to all your other important organs. In heart failure, when you move about to do your daily activities, the heart isn't capable to meet your body requirements. Your body is asking for more, so this manifests as breathlessness. You may also experience a persistent cough because of the buildup of fluid in your lungs, and you may need extra pillows at night to sleep, as lying flat may make the breathlessness worse. Signs, or what we call clinical signs, are the clues we pick up in clinic from our examination of you to suggest you have heart failure. There is excessive fluid in your body, and that results in fluid not only in the lungs, but also fluid accumulating around your ankles and therefore increase in weight because there is too much fluid in your body. The reason behind this is that the heart's job is to pump blood to the rest of your organs, and an important organ is your kidneys. The kidneys' job is to balance the water in your body, but because your heart isn't pumping enough blood to it, the kidneys get tricked into thinking there isn't enough water in your system, so it stores more and more, and this causes you to have too much water in your body. There is obviously a lot more going on here, but that's a simplistic way to look at it. There are 4 stages of heart failure. These stages describe how serious your heart failure is. When you're diagnosed, your doctor may tell you which stage you have based on your symptoms. In stage 1, you don't have symptoms during everyday activity. Stage 2 is when you feel normal when resting, but physical activity like walking up the stairs causes symptoms. In stage 3, you feel normal when resting, but even a little activity like going to the kitchen to make some tea causes symptoms. And stage 4 is when you can't do any physical activity without symptoms and may feel uncomfortable while resting. You can be at any of these stages when you're diagnosed. There are many reasons why you may develop heart failure. It can happen suddenly, or it can progress slowly over months or years. So the important thing we do as healthcare providers looking after you is to identify exactly what is causing your heart failure so you can be treated in the most appropriate way. Heart failure can be caused by abnormality within the heart itself, or because of excessive requirements placed on the heart by the body. One of the most common causes of heart failure is because of a heart attack. After a heart attack, the area of the heart muscle affected essentially dies. This causes long-term damage to your heart, affecting how your heart can pump blood. Other causes of heart failure are high blood pressure and diseases of the heart muscle called a cardiomyopathy. Cardio meaning heart, myo meaning muscle, and pathy meaning disease. These can be inherited, like hypertrophic cardiomyopathy or dilated cardiomyopathy. Abnormal heart rhythms such as atrial fibrillation can also cause heart failure, and certain toxins, in particular drinking excessive alcohol, and some chemotherapy agents too. So what about conditions that result in excessive requirements on the heart? These are things like when you have a low blood count called anemia, or an infection causing sepsis. These are called high output heart failure, meaning your heart is really trying hard to keep up with the extra demand. In these cases, if the underlying problem is treated, then the function of the heart usually improves. So how do we diagnose heart failure? Firstly, from clinical assessment. That means taking a careful history, asking questions about your symptoms, and examining you to look for the signs of heart failure that I mentioned before. We also do some tests like an electrocardiogram or an ECG to look at the rate and rhythm of your heart. We do a special blood test called brain natriuretic peptide, or proBNP, which if raised increases likelihood of heart failure. We may also do other blood tests depending on the cause of heart failure. And finally, we do imaging of your heart. We usually start with an echocardiogram, which is an ultrasound of your heart. Your doctor may talk about the ejection fraction of your heart. This is to do with the amount of blood squeezed out of the main chamber of the heart with every heartbeat. It's usually measured as a percentage. Over 50% is considered normal. Your ejection fraction is measured from an echocardiogram. Heart failure can be put into different groups depending on your ejection fraction. Depending on the percentage measured and other tests, your heart failure may be classed as either heart failure with preserved ejection fraction, where the ejection fraction is over 50%, heart failure with mildly reduced ejection fraction, being between 40 to 49%, and heart failure with reduced ejection fraction, where it's below 40%. There isn't a cure for heart failure, but available treatments can help manage symptoms and improve your quality of life. Your doctor will discuss treatment options with you depending on what stage they've diagnosed you with. In terms of general advice, we encourage you to keep active, which has been shown to boost energy levels and improve your sleep. Keeping to a healthy weight and diet will help your overall health and prevent extra strain on your heart. Also, limiting how much alcohol you drink lowers your chance of getting abnormal heart rhythms, high blood pressure, and diseases such as stroke. Stopping smoking and using other tobacco products also reduces your risk of developing heart disease, and I've done a whole video about the effects of smoking on your heart, so do check it out if that interests you. And practically watching the amount of fluid you have each day and weighing yourself regularly to look out for sudden weight gain, as this may mean you have too much fluid building up in your body, which may need to be treated. Living a healthier lifestyle can be hard at first, but it's important for your overall quality of life. We would normally link you up with heart failure services, and you will have a dedicated heart failure specialist nurse for advice and support. This makes a big difference to your overall management of heart failure, so please do engage with the service. In terms of medical treatment, we want to improve your symptoms, but also help to support your heart function. It's really important that you follow the advice from your doctor and take the medicines you're prescribed. In terms of improving symptoms, you may have heard of water tablets, which we call diuretics. They are not water tablets per se. Their job is to get rid of excess water in your system, so help with your symptoms such as breathlessness and leg swelling. The second aspect of medical treatment is to delay the progression of heart failure, and there are several medications we can offer. We have three main family of drugs, the first being beta blockers such as bisoprolol, second being ACE inhibitors such as ramipril, or angiotensin receptor blockers such as losartan, and aldosterone antagonists such as spironolactone. These three families of drugs work in slightly different ways to prevent your heart getting weaker. We know that those people who take these agents live longer with heart failure, and they reduce your risk of being in hospital from heart failure. A combination of these works better than one alone, and we usually titrate up in dose as tolerated. The other important medication that is relatively new and has been around for a few years now is sacubitril valsartan. This really changed the landscape of heart failure. It's a combination drug, so if you are started on this, you wouldn't also be on an ACE inhibitor or an angiotensin receptor blocker, as this agent already contains the drug. When you're on these medications, we would monitor your kidney function, as they can cause electrolyte imbalance. Another newer medication which is being used is SGLT2 inhibitors. This was initially used for diabetes as it works by increasing the amount of glucose passed in the urine. DAPA-HF, which was the big trial, found that heart failure patients on this medication did better than those who were not taking it, and it also reduced hospitalization from heart failure. I'm now going to talk about surgical or procedural treatments in heart failure. If your underlying problem is valve disease, then you may have that abnormal valve repaired or replaced to improve your heart function. If it's related to atrial fibrillation, we can do a procedure which is usually as a day case, where we can potentially restore you back into a normal rhythm using electricity or sometimes with catheter ablation, which is more complex. We can also implant pacemakers, which can synchronize your heart so each beat is more effective. This is called cardiac resynchronization therapy, and there is a specific criteria for this. And finally, in certain situations, you may be a candidate for heart transplantation. But again, there are specific guidelines for this, and this is very much advanced heart failure therapy. Heart failure treatment has come a long way, and there are now lots of options we have available. Being diagnosed with heart failure can be upsetting and raise concerns about your life expectancy. If this is something you're worried about, talk to your GP or your specialist heart failure team. They will explain what to expect during your treatment and give you the advice and support you need. So that was really an overview of heart failure. It's important to appreciate that every case is different, and a treatment that is right for one person may not be suitable for you. So it's really important to discuss the treatment options with your healthcare provider so the most appropriate treatment is designed for you. Do you have heart failure, or do you know somebody with the condition? Let me know in the comments below how your experience has been. Thank you for watching, and I'll see you in the next video.